Hi guys, thank you for joining in. We are the Public Health Rookies. Today we are joined by Michael, a fellow
Everyone.
MPH castmate, and MPH candidate. Akila, your favorite. Faris, who's always behind the camera, but now he's in the hot
I'm your
seat.
new favorite.
He's just trying to take my position. And Will. Clap, clap, clap. And today we are talking about the social determinants of health. And I'm really, really, really excited to talk about this because this is kind of the entire reason why I wanted to get an MPH degree. So I thought it'd be really fun to start off with like a little story to kind of get like the gears running. So Michael, you want to take it away?
Sure. So there's a kid, and let's call him Joe. And just to be clear, it's not Joe, not a public health rookie, just a made-up person. So Joe was raised by a single mother along with his two younger siblings in the outskirts of a major city. They lived in a small house infested with cockroaches, less hygiene-oriented, broken appliances, windows, and the mother had worked two jobs. As Joe entered middle school, he started reporting difficulty breathing during gym class. After talking to his mother and his primary care provider, he was diagnosed with asthma.
Dude, Joseph lived a rough life. What the heck?
I was going to say the entire time we were saying Joe, I was thinking about Joe,
Poor
who's
Joe.
behind the camera, FYI.
Poor Joe, dude.
Good thing Joe didn't experience that.
Yeah. Okay, so now if I ask though, like how he got asthma, like the answer is not simple, right? There's so many different factors that played a part into how he got asthma. And I think it's pretty obvious to say that like health is not directly based on your genetics or your biological predispositions. And this is kind of where social determinants of health play a part.
Yeah, so when we say social determinants of health, that refers to all the different conditions and factors within your environment growing up that contribute to your overall health and how you end up living your life. So that includes where people are born, where they learn, where they work, where they play, where they worship. And that can affect things from, like I said, health to bodily functioning, your quality of life, and outcomes, and different risks that you're exposed to. So some examples of this to put in context, we talked about Joe and his asthma, but there's also access to safe housing in terms of your environment that you're growing up in, and your ability to access transportation or safe transportation, the neighborhood you grew up in. There's racism and discrimination and violence, and that goes back with neighborhoods in terms of like redlining. There's educational opportunities, job opportunities, and income opportunities that obviously are different for people coming from different areas. And then there's also access to foods, how close you are to supermarkets, or whether or not you're in a food desert. There's the polluted air, water that you can be exposed to, and then language and literacy barriers that certain people may have.
Yeah, and the social determinants of health can be more or less categorized into 5 different domains, and it's the way the CDC, according to the CDC website, they describe it. And the 5 domains are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context.
So today we're gonna go into those different domains, and I think the first one we're gonna talk about is economics, because someone's economics and their position in life can change their opportunities. And as we've been talking about, opportunities can cost your livelihood, which can lead towards costing your health. 1 in 10 people live in poverty, which means that these people can't afford some things like food, some healthcare, housing. Okay, you could have a house like Joe where it's infested with cockroaches, or you could have a really nice posh house which has air conditioned heating, everything that you need to live. And then people who live in poverty, they are less likely to be healthy. And this is going to also impact more down the line with limited health access or healthcare access and limited things to their health. They could be having trouble with the ability to work, which could stem into, as we talked about, more problems. I mean, you have worse health, you can't work so well, then you have even worse health, right? Everything just piles down. And then they can't afford some things that they need,
Yeah, I think a lot of people forget that, like, it's not, I mean, you can easily point out, like, that's the one thing, like, they live in that neighborhood, but there's so many, like, you probably gotten the hints of, there's so many things that come as a result of one thing and lead to another thing, and then generationally, and it's tough for people to escape that.
Yeah, and I think it's like, well, I'm gonna, you know me, I always have my pop culture references. Like, you'll never see a TV show or anything where it's like, you're never gonna see someone in like a low income, right? But like a really good example of like where you're born and how that affects like your future is like Gossip Girl. I hate to say it, but it's Gossip Girl.
I was waiting for that
These
reference.
people are like Upper East Siders, like, and you see the opportunities that have been just given to them, right? It's just like literally handed. And like
Just
Dan
handed.
being the outsider, honestly, Dan is so good because Dan's from Brooklyn. Like, I can't really say he's like low income. He's not.
No, you know what? He lives in a loft.
Oh yeah,
in
that's
New
true.
York.
Okay, but in
they
Brooklyn,
act like they're so poor,
Yeah, yeah,
and he's
yeah.
got like a huge loft
it's a
Huge
3-bedroom
windows.
loft,
Right.
Like that's easily.
in a nice neighborhood too.
Let's guesstimate. I think that's like $6,000.
I would guess
Oh,
more.
per month.
It's
Honestly.
definitely millions.
It's gotta
Well,
be
like I'm
millions,
saying, like
right?
a monthly rent would be like
Yeah.
$6,000.
The cost of living there is terribly high.
Yeah.
So, but he
So
acts like he's poor. I mean, like
Yeah.
I guess it's all relative
Maybe it's a
compared
trend,
to the
it's a
people who are
fad.
like billionaires. But like I get very frustrated by that because the
Yeah.
whole woe is me thing just doesn't.
he's
do
like,
it.
I don't fit into your world, boy. You're literally basically in that world.
Yeah,
Like, don't even
right?
get me started.
bothers me.
Okay, I just went off on a tangent, but I have some statistics which I think would be very helpful. So like what Faris was saying, low income individuals tend to live in like poorer neighborhoods or rural areas, while high income individuals live in affluent neighborhoods. And there was this like research done by like the Wise Woman, and it's literally called the Wise Woman Program, and it's funded by the CDC, where it kind of collected data from like 2,000 low income women. And it basically suggested that there's like a dependent effect between individual affluence, like the money that they earn, like through whatever means, and its relationship to BMI and CHD, which is coronary heart disease. And it literally said that low income women living in rural towns are approximately 12 pounds heavier and have a 19% greater chance of CHD risk in 10 years than women living in like affluent neighborhoods. And that's insane. Like
It's a big
19%,
difference.
like, and 12 pounds heavier, like that's a lot.
Well,
And more. Income level disparities exist in like poor neighborhoods because of like what Will mentioned before. You have a lot of increased fast food restaurants, decreased fitness facilities, lower availabilities of like grocery stores and healthy food stores. My favorite, like Whole Foods and Trader Joe's, like you're not going to find those in like poorer neighborhoods, which is really unfortunate. And they have higher obesity
well,
rates.
going with that too, those stores are more expensive to begin with
Yeah.
too, right?
So like people can't even like afford it.
Yeah.
And I think this really reminds me. I didn't introduce to our audience, but I'm from Philadelphia. I went to school in Philadelphia, and I had volunteered with this initiative called Man Up, and our program was to provide medically nutritious or medically tailored meals for like the disadvantaged populations of Philadelphia, and often they'd be like discharged from the hospital and they'd be very low income, very disproportionately minority populations like African American and Latino populations, and the reason why this service the program that I was volunteering for was super helpful was that it a lot of the residents didn't have access to nutritious meals. There were there were quite a bit of fast food restaurants, not a significant amount of organic foods. At least they were probably very expensive to afford. So it was really helpful for those initiatives that would provide, nutritious meals, especially those that are like diabetic friendly, keto friendly.
Wait,
low
that's
in,
awesome.
Yeah,
actually.
low in for those that have diabetes, and it lowers cardiovascular risk.
Right.
So
That's really cool.
That's crazy.
Yeah.
I was also thinking about like where we live. We live in a pretty rural area, Hanover, but we have like our closest like food store is called the Co-op, and I actually go there quite a bit. But like because I didn't have a car before, I'm just diving in a little bit. But it's actually ridiculously expensive, like more expensive, and like a lot of people go there, and like, which is kind of insane because I don't know how people can necessarily afford it. It's actually very pricey.
Gotta drive to West.
Yeah, yeah.
that's
we
why I
have
go
to
to Price
drive.
Chopper.
Price
Huh?
chopper.
That's
Yeah,
Or
we gotta go
even
to
then,
Costco.
you have to have access to a car.
Car.
To be able to do
And I
that.
didn't, so
And
I
I-
had to go to the more expensive one,
Yeah.
which
So,
still wasn't worth
Money
it.
limits your opportunities, which limits your ability for healthy, easy food.
healthy food options.
And I think another thing you could think about, I mean, as we said earlier, fast food restaurants are cheap, but they're also insanely unhealthy. And you might think that because you have less money, you have less food. But I mean, people have to eat, right? They're still living, and they're just going to where the food is cheap. And where is the food cheap? Where the burgers are.
Yeah.
So
I mean, yeah, McChicken, $1, and I'm telling you, it's great.
I used to work at McDonald's.
Wait, really?
Yeah, I mean, you know, you got the McChicken for $1. You got the chicken nuggets for like
Yeah.
like $2 or $3. I can't remember which the dollar
Do you
menu
want
is.
to know the biggest steal on the McDonald's menu?
What is it?
But
You can get 3 chocolate chip cookies for $1.
Oh,
No
I dig that
freaking
so much.
way.
Yeah,
You know, I
not
love
a lot of
chocolate
people
chip
know that. Their
cookies.
cookies are really, really, really good.
Really?
Yeah, that's a
I'm
must
so
every
hungry,
time.
you guys. I'm so hungry
Yeah,
right now.
I haven't eaten.
Okay.
when I
I
was a
can
kid,
definitely tell that when you eat the chicken. I mean, sure, it's very good. I like McDonald's, but you can tell that the chicken probably is very processed and
It's not chicken.
That's
okay.
It's
It-
fake.
Take that $1 and spend it on the cookies.
watch
You get
McDonald's.
the
first.
why
vlog
are
our
you
video.
advertising the cookies? That's still unhealthy.
Oh, you know what I'm planning to do actually? I'm being very serious. I'm planning when I get married, I want McDonald's cookies catered at my reception.
Wait,
because
are
that
you
would save-
serious?
Yeah, because that would save so much money.
Oh,
3 for
not
$1.
because you love it.
No, I do love it.
Okay.
I love it.
Well, I'll
I'm
help you out
loving
with the
it.
desserts. We're
I
not
better,
getting you
I better
cookies.
get invited. I love my chocolate chip cookies.
Wanna
Yeah.
go, where's the chocolate chip?
Hmm?
Where's the chocolate chip cookies?
Moving on.
Yeah, let's move on.
So another aspect that we wanted to talk about was education access and quality. And it's very well known that people with higher levels of education are more likely to be healthier and live longer. Obviously, you could make a direct connection to wealth with that too, because usually people who have more money are able to go to more affluent schools, or they're in school districts where there's more funding, maybe more resources in terms of being able to fund healthy lunches. Also, children from low-income families who have disabilities routinely experience forms of social discrimination in these environments, like bullying. They're also more likely to struggle with math and reading. They're less likely to graduate from high school or go to college. And this means they're less likely to get a safe, secure, high-paying job and more likely to have different health problems like heart disease, diabetes, and depression. Furthermore, some kids who are in school in places that are poorly performing, their parents obviously can't afford to send them to better schools. They're kind of restricted to that area, as opposed to someone who's maybe more affluent, who could afford to, send their kids to a private school somewhere else for a potentially better education.
I was gonna say, like, for college, it's such a money game because, like, SAT prep, like, if you have affluent parents, they're gonna pay to get you, like, the best tutor out there, to get you the best SAT score. Then you go to a great college. Then, like, the opportunities you get in life are just insane. So it's just, like, a constant feedback loop. And I think, like, nowadays people are thinking about that more, obviously, because SAT, all those standardized tests have become, like, test optional for colleges, which I'm really happy because it is so discriminatory and it's, like, not even worth it.
It's not equitable.
Yeah,
That reminds me of the college admissions scandal. You guys remember?
Yeah. Yeah.
And really, it ties in because those that were obviously could afford the, like massive payments to those sports coaches to get their kids into colleges. It really ultimately left people of color and people of low income status. I mean, obviously, they don't have access to those resources, and it just facilitates those inequities.
This is a scandal where the school made a catered application towards the colleges, right?
Exactly.
No, it was Becky. It was Becky from
Aunt
Full
Becky.
House. Aunt Becky. She falsified her like daughter's or I guess they did like extracurriculars, like they did like rowing or something. Rachel's like literally telling me in the back. She falsified their like college application and then they got into like USC.
I think I'm thinking of a different one where there's this entire black school and the entire school they make these videos and make it seem like a really top school but instead they completely falsify the college application process, and
I've never heard of
Yeah.
that. But wow. Wait, an
That is-
entire school?
the entire school, like everything looks like the dream thing, and then they make like videos about how the students are so happy when they get into Harvard or whatever, and it just really just shows a big scandal of like this whole college process. But yeah, like the people you're with or the people you're around, like education matters a lot, but like with that stress in mind, there's so much pressure by everyone to do something, and I mean that's why there's a lot of cutthroat people out there.
Yeah, to give some numbers to this, this study investigated the social predisposition for Black individuals in America developing colorectal cancer, and they found that the prevalence was 20% higher for Black individuals, for Black populations compared to white populations. And also another fact, in migration studies, they found they did a sort of an interesting design where African Americans typically consume a diet that's high in red meat, fats, low in fiber, whereas looking at South African populations, they ingest a diet that's much higher in fiber, lower in fat and red meats. And when they conducted a study in which the two Black populations had swapped diets, they found that at the end of the study, the African Americans that had the higher fiber diet, like the South African population, they had a higher gut flora, had higher gut flora bacteria, indicating better gastrointestinal health. And I think what this really means in terms of going back to the food options we have in our built environments and in the neighborhoods that we live in, the food options that we have, they really determine health outcomes such as colorectal cancer.
You can point back to the long-lasting impact of like redlining and those kind of racist policies that put them in those low-income neighborhoods where they've kind of been stuck for generations.
Yeah, to kind of explain what redlining is for those that don't completely know, and I actually learned this a lot more myself, probably like around the COVID pandemic and the George Floyd protests.
Yeah.
I really got a chance to like learn a lot about it. But basically, what redlining was that a little bit of a history lesson. So in the 1930s, after the Great Depression and like the passing of the New Deal, what a lot of city governments had done was they would add parameters. They would take a look at the map of a city, and they would say they would rank each part of the city with like A through D, sections of like the geographical map, and say like what A would represent would be how homes with high home property value, and then D, like the D rating would be ones with low, and ironically enough, the ones that were ranked D were very disproportionately African American poor. And the reason why this matters is that as homeowners in those districts, in like the D ranked districts, as they went to apply for a loan, for a housing loan from their bank, they were more often to be denied if they were from like that region.
And even bringing that back to school, I know you mentioned the property values. That's how they decided it. That's how they decide public school funding too.
Yeah.
So.
I was gonna say, like, I'm taking a class right now. It's literally called Health Determinants, but our entire thing is about housing. And what Michael was saying is that it's kind of like the whole concept behind it. It was redlining, but it's also like white flight. The moment that a lot of like African Americans would just like be in the same neighborhood, all like the white families, they would just dip out, bringing the property values super low, and like just like the property taxes weren't good. So what funds like schools? What funds the roads? All of that, right? And the other thing is like most of these places are also kind of like sidelined, like they're not really like in the major city. Like if you go to a city, they'll probably be at like the outskirts and stuff, aka like East Lake, Atlanta. If you guys want to look into it, really great. Like there's a really great documentary about it, but it was so crazy to even think about. But basically, since they were so sidelined, they didn't even have access to like police patrolling, like even like the basic necessities of like cleaning services, like even like an ice cream truck wouldn't get there, right? Like these kids wouldn't even have like yeah, you need your ice cream. Like these kids wouldn't even have like a normal upbringing or like a normal, like they just wouldn't even have these like necessities for kids. Like I don't know, it was just really heartbreaking to even hear about. But if you guys want to check it out, there's a really great documentary about it. It's called East Lake Meadows in Atlanta.
And you can stream it on.
I don't know because Will always
We'll
puts
figure
me
it
on
out.
the spot.
We're gonna put it right here.
Yeah,
And if
yeah.
we don't know where
Ding.
it's streaming after we Google it, then we apologize.
We'll link it somehow.
Yeah.
We'll figure it out.
One more thing I want to bring up is as we talk about these ideas of like opportunity and like how people are getting their education or even their employment, I think you guys as viewers should think about what is the reason, where does all of this stem from? Why are people limited by their opportunities, and what caused them to be put there? I mean, there's so many stories behind someone's, not just their health. I mean, this is a public health podcast, but not just their health, their opportunities, their work, their housing. There's so many things that you have to think about and that make up a person or make up a person's history. And definitely think about the reason why someone is doing something.
I remember learning about a sociological concept called intersectionality. The fact that race, gender, class, so many other aspects of your social and personal identity really overlap to, contribute to where a lot of people end up in life. And I think also another aspect of this is that it's more or less like a positive feedback. Going back to our examples of people living in impoverished areas and places that don't have access to like nutritious foods, it's very much like a positive feedback loop. Like if you go out poor, you're on average more likely to not achieve an education, a higher level education, and therefore the next generation will have more. Also, a lot of obstacles, as opposed to if you grow up wealthy, then you might facilitate that wealth. And it's kind of important to kind of hopefully break that cycle to improve equity.
Yeah. I also think it's crazy because we've never actually had to think about intersectionality until maybe like 150 years ago, when all these groups from the entire world kind of just like moved in. Like before, it was just like white men. It was just like white. It was literally just white people. We were rude, and we literally just like sidelined the Native Americans, like the indigenous population. But like we've never had to really think about it, and I'm really glad that it's like in the forefront of public health, because it's not what Michael said. It like determines like who you are as an individual, and it determines like the choices that you make, how you think, like your parents are like whatever your parents have gone through affect you, like all these things really affect you, and we've never had to think about it until recently.
Well, I mean, you still have, you have to think about it in a global perspective. There's still been a lot of economic disparities, like throughout generations. I mean, you have the class system back in like Egypt and India. I mean,
Yeah, we have the caste system back in India.
So, I mean, this is something that's always been going on, but just thinking about all the perspectives that make up a person's health is very important, especially in today's society where I think we are more or less trying to push for equality. And when we're pushing for equality, we have to think about all of these on what makes people equal.
Moving on, our third domain. So our third domain, we're going to be talking about healthcare access and quality. So 1 in about 10 people in the United States don't have health insurance, which is shocking, honestly. And people without insurance are less likely to have a primary care provider, and they may not even be able to like afford healthcare services or even the medications they need, even though it's like a necessity. And there's a lot of different strategies to increase insurance coverage rates, and it's really important because people need to get the treatment they deserve, especially for like diabetes, coronary heart disease, like depression, like all of these. Like insurance is definitely like a huge hindrance in people getting like the basic treatment that they need. And
I actually I volunteered in a clinic that only served people who didn't have health insurance. And that was really, I'd never had that kind of perspective before. It was really humbling to see. He's a rookie. He's a true public health.
No,
rookie.
he's
Sorry, guys.
No, but yeah, it was really humbling to see that, and just how grateful they were to receive that healthcare, because it really is it's a human right, and it's such a shame that there's a monetary barrier to that.
On that line of I think like also the important, I think it really emphasizes the importance of preventative medicine, and kind of like if we think back to COVID. And actually, I have a statistic here. Black individuals more likely to receive delayed cancer care after their initial diagnosis compared to their white counterparts. And also, cancer screening during that time of March 2020 till probably the couple months until June of 2020, cancer screening decreased by almost 90%. So I think it's just really important understanding especially there's very long term and far reaching deficits if you don't receive cancer care and the appropriate long term treatment of your chronic conditions. It really can. It's important to get preventative care as opposed to treating the disorders that may develop.
But you
after
could
that.
you could point to a lot of other factors that could have prevented that, like the built environment. Like if there's if they have to rely on a bus to get them all the way across town, so that's where the only testing center is. If they can't afford that bus, and it's I either pay for the bus to go get that test, or I buy dinner for my kids. To have to decide that is really tough.
Also,
Go ahead.
also going on from that, if you think about healthcare access, think just rural environments. I mean, a lot of what they've been talking to us this year about was the idea of living in a rural place where, let's say I don't have a car and I'm poor. Well, how am I getting to the nearest hospital, which is 2 hours away? I mean, you gotta ask a friend here. What are you gonna do?
And you're gonna take off of work that day.
Yeah, 'cause
Something people obviously don't want to do.
you need
Yeah.
the money. I mean, what if you're taking the tractor to the hospital and you need to use that for work? I don't know. There's so many things to consider because people are complex. So thinking about that complexity and how you can get your access, and even then, if we're talking about quality as well, I mean, what if you're in a rural environment and your nearest clinic is an hour or 2 hours away and they're overstaffed, or I mean they're understaffed and they don't have the ability to treat you for, you need an MRI scan. Well, the nearest MRI scan is 4 hours away. Well, shucks.
I was gonna say, even now, it's been a couple years since COVID, but I just don't think our healthcare system has kind of caught up to the population. I just don't think they could handle the population of the states. Even to get an MRI, people have to wait 3-4 months, right? And that's things can happen in 3-4 months that can deteriorate your condition exponentially. And it's just really sad to even think about. Even when it gets to cancer, the minute you find out, you want your treatment ASAP. But then to have to wait 3-4 months to even start getting anything, it's ridiculous. But
in one of our classes, we had in one of our classes we did a little exercise in which we try to go to each of our states' Medicaid websites and apply for eligibility. See if you're eligible, and the goal of the exercise was to see how easy or how hard it was to apply for it. And what we found was that it was oftentimes we'd go to the website and we'd have it'd be really confusing. It'd be really this really super convoluted way of their application. The website may have had broken links, and I think that really speaks to how it's very difficult to access, depending on where you live, and also the fact that our healthcare system has quite a bit of flaws. It speaks to how difficult it is to gain the healthcare that you need.
All right, moving on.
Faris, you want to take it away?
Yep. So next domain that we're going to talk about is your neighborhood and your environment. So I'll just talk about it like this. Many people in the United States, they live in environments that are not exactly the most ideal environment. I mean, you got the Brooklyns and you got the not so Brooklyns. They could have high rates of violence. You could have unsafe air, water. You have a lot of safety risks that can pose a problem to your health, or you're just around an unideal environment that is bad for your growth. I mean, think about your kids. Think about what you're doing or what your goals are. People have different goals based on where they live. And sometimes they have neighborhoods where they group or do segregation, or they have racial or ethnic minorities that are living in some of these neighborhoods, or these neighborhoods themselves are low income. So these are risks that can, as we talked about before, with the Class D or Class 4 neighborhoods. I forgot what it was. D. These are risks to your health and to your growth as a person.
I was also gonna say, in addition to that, like just like open space, sidewalks, parks, like these are all also important, and no one really like you don't really think about it when you're thinking neighborhood. You kind of think about like the physicality of it all, but like these other components really matter as well.
And then the last domain we wanted to talk about was social and community context, and this relates to who you're interacting with every day. So your family, your friends, your coworkers, your classmates, your different community members that you're in groups with. They all have an impact on your health in some way. Um, and the relation to this in terms of like how it relates to health is some people face a lot of challenges that they can't control in terms of safety, in terms of who they hang out with, and that like the environments they bring them to, or whether or not they aid them in pursuing a healthy lifestyle or not. And people who live in positive or have positive interactions with people, that can sometimes reduce that. Like if you have a lot of support at home, or you have teachers that are really looking out for you, but some people have no control over that. That's like, people who have parents in jail, or adolescents who are bullied at school, and that's going to negatively impact them down the run. But it is really important that interventions are done when they can be, to help those people to sort of break that cycle and not leave them, victim to all the things that might come with the people that they're associated with in the environment that they're in.
I've heard a recent thing from one of my friends that you are who your closest 5 people are. In a way, like we absorb traits from our friends
That's
and
true.
from other people and from obviously your family members. So thinking about this, how your close group, how your close environment changes you as a person, it can change a lot. It can change your personality, it can change your goals, and goals are everything in a lot of how we grow as people. So with all of these in mind, I mean, it could change you from being the next like Harvard inventor of something to making the next McChickens, you know?
McChickens. Yeah, I actually read it. This is a while ago, but I remember the gist of it was that, as you said, like the people that you surround. Basically, the way they phrased the study was that obesity is more or less contagious, almost like in the context of like a virus, but like because you are surrounding yourself around people exhibiting particular behaviors, and more likely to exhibit that. And perfect case in point is obesity. What they found was that your social network tends to be on the unhealthier, like choosing unhealthier diets. You're more likely to follow that similar pattern.
I was gonna say freshman 15 is a perfect example of that, because you're just like surrounded by people at basically an unlimited buffet at your dining hall. I was eating like fries almost every day because all my friends were eating fries, and I was like, okay, well, if they're eating it, I'm eating it, then it's fine. Like, I'm not going to be affected by it a different way than they do. Obviously, I gained like 15, 20 pounds, and I came back from break.
I think I did too.
Yeah,
Maybe not that number, I forget, but I definitely gained some weight then.
Mine was so bad to the point where like I came back and my mom couldn't recognize me. She was like, "What?" And I was like, "Yeah, it's okay. I'm gonna figure it out." But it's okay. I like worked out like insane, and ever since then I've been super healthy. So like.
15 pounds. Oh my god.
No, dude, honestly, like I didn't realize it because my clothes were still fitting me. So I'm like, oh, everything's fine. But then like I looked whack. Like I think it didn't hit me until my mom told me. I looked at myself in the mirror. I was like, damn, I look so weird right now.
That's how you know the food is good.
Yeah,
You pick the right school, right?
Yeah.
I think honestly, I didn't have the freshman 15, but what I did have was when I was during COVID, and especially when I was studying for the MCAT, I literally just like I buried myself in a room for a month and just was eating, I think, burgers and stuff like for a straight month. And then I gained like 20 pounds. And I'm like, oh shit.
Yeah.
Oh, so you're the freshman 20, not the. Oh, that was your junior year, right?
Junior.
Gotcha.
This is
Junior,
COVID.
They're just delayed a
junior
little bit.
20. I thought it'd be interesting to add a little numbers and data. So in this research study that measured social networks by this Berkman-Symes Social Network Index, it's basically a self-reported questionnaire, and it had 4 measures, which was marital status, number of close friends, regular attendance of religious services and participation in church services. And it basically said that participants with higher level of social integration were generally healthier regarding better lifestyle behaviors like less smoking, fewer chronic conditions, higher level of like physical activity, and fewer depressive symptoms. So you can really tell that like who you surround yourself with is clearly gonna really help you out in the long run. So make good choices and make good friends.
Surround yourself with good people.
Yeah, essentially. Also, I know we gave out a lot of information in this. If you guys have any questions, just comment below. And if you're lucky, we'll respond to you.
Sure,
Just kidding. I'll respond.
So given all these domains, we discussed economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. I think an important aspect of seeing, we have all these 5 domains. There's a lot of overlap with a lot of these domains and topics, and I think the idea is that they really weave together. And something we've talked about in our classes is the types of frameworks in which we understand the social determinants of health. So one framework is the social ecological framework, which emphasizes multiple levels of influence and supports the idea that behavior is both affected and they both affect and are affected by various contexts. So it'd be, for instance, the individual, the relationship, societal, and community. And also another framework that we discuss, especially something that I kind of look more into, is the social determinants of health model. And the idea is that we have all these domains of social determinants, but we can sort of model it like a stream or like a river. So like the upstream is more like the broader, maybe like the societal and maybe educational or income determinants, whereas like there's like a midstream and a lower stream that really impacts more of the individual.
Don't get confused by social determinants of health and then the social determinants framework. Those are 2 different things. But like definitely, yeah, it's a little confusing. But this is kind of how like public health officials kind of understand what's going on and configure like a solution to the problem. And it kind of like puts it out in a very clear format. It's honestly one of the first things that we like learn in our entire program, which is really nice. But if you guys want to look into it, please do, because it's very interesting.
And it's just important to think about it because basically things are stemmed from other things, right? Your health is stemmed by a lot of factors. So you have to look at the bigger picture and look at how everything's impacted you that leads to your health and your lifestyle.
Yeah, that's a good way of saying it. It's a bigger picture.
Things lead to things.
Yeah, things leads to things, as Faris says.
You can quote that. But anyways, it's time for book talk.
More fun!
Woo! So today I present to you a book here, and basically it was recommended by Rachel, who sadly could not be here with us today. But
she's literally behind the camera.
She's
She's
right
our producer / director.
Shout out to Rachel.
Today.
she sadly did not want to be here today, but she misses you guys a lot.
Miss y'all.
And it's called Medical Bondage.
Why are you saying it like that?
It's a serious book.
Yeah,
It's a very serious book recommended by Rachel, who recommended that by a good friend of mine.
All right, next time if Michael's back, we're gonna make sure that he keeps his watch
Oh,
silent.
I guarantee. I
Yeah.
guarantee.
Promise?
Yes, I promise.
All right.
all devices shall be silenced.
Please.
I think my thing was silent, but
Well, it was
Apparently
not.
Really, it was not.
Yeah. So
maybe I need to check my iPhone settings.
we're gonna triple
Something's-
check before we bring Michael back next time. But next week we're gonna be talking about mental health, and we're gonna talk about a lot of cool stuff. So you'll definitely want to tune in. Make sure to like, comment, and subscribe. Let us know what kind of other topics you want us to talk about. We're planning on bringing in some guest speakers, some more new people to talk to. So
You'll see us.
stay
though.
tuned.
It'll be fun.
Bye, guys.
All right,
see you
next time.